We have some unsafe herbal ingredients that we've called out in magazine articles that we publish every couple of years, and many of them have remained on the marketplace for a very long time. So, for example, we published an article in 2004 warning about yohimbe and chaparral, lobelia.
And what are those?
These are herbal supplements that have a variety of side effects, and we recommend that consumers don't use them. One of the other ones we warned about at that time was ephedra. And so with the exception of ephedra, the other ones I'm mentioning are still on the marketplace today. So an important takeaway is unsafe ingredients can remain on the marketplace for a very long time. With the case of ephedra, this is a stimulant that was linked to strokes and heart attacks, linked to several deaths of professional athletes and young athletes. And there were tens of thousands of adverse event reports about this product about going back 10, 15 years. And it fell to the states, actually, to ban the product. It was first banned in New York, Illinois, and California before the FDA was able to take action on it. And the reason is, in the Dietary Supplement Health and Education Act, there's a very high standard of proof for the FDA to remove products from the marketplace. And they haven't used the authority that they have very often. So the concern we have, too, is with the size of the marketplace, FDA's resources really haven't been able to keep up. They have roughly a budget of $5 million and 24 people to police a marketplace with 90,000 products. It's 10 times larger than it was in 1994. So there's a real concern about safety that the government is not able to act in a prompt and effective way to get dangerous products out of the marketplace.
But the instances you mentioned where suddenly certain products are banned in certain states or localities, what does then the company do? What obligations are they under? Do they just, well, we're not selling there anymore, or is there any penalties or things they're forced to do?
Yeah, so I mean, it's very unusual, actually, for states to take action on something like that. In this case, it was particularly egregious, and it was very clear that FDA would not act. Now the FDA has pulled the ephedra back and is not allowed to be sold. So companies have responded, but they're responding by going to introduce similar ingredients that also have stimulant effects for weight loss products. And Peter might want to say more about this, but they haven't given up. They're trying to innovate and come forward with other ingredients that are legal, but nevertheless may be risky for consumers.
Peter, you want to add something?
Right. After ephedra was banned, that's when we really saw this explosion of creative stimulants that are really synthetically, pharmaceutically created tweaks. And those stimulants have found their way into the weight loss products, but also into many sports supplements. So my advice to consumers about the sports supplements is avoid, or actually this is across the board really, to avoid supplements that contain something called a proprietary blend. So a proprietary blend allows the company to put in ingredients without telling us about the amount. And in those products, and you can take a look at the back to see if there's a proprietary blend, those tend to be the higher risk products. So that would be one tip I would share with consumers.
Bryn, I want to go to you. We're talking legislation, and I know you're involved at the state level. What's going on at the state level? I know your focus is on youth, particularly around weight loss drugs and where that intersects with eating disorders. What's happening?
Sure,
there?
yeah, and as Chuck said, it was really incumbent on states to take action first around ephedra. It certainly wasn't sudden. It was a lot of work by many people to get states to move many years ago, and then finally motivated the FDA to move on ephedra. We're in the same situation now. Our group did a legal study a few years ago, led by Jennifer Pomerantz, a colleague of mine, a health law specialist at New York University, where we laid out basically the roadmap for what states and cities can do to act on this to protect consumers, to protect their residents, and especially from our perspective to protect children and adolescents. And there's actually a lot that states and cities can do. We don't need to wait for the FDA. We don't need for Congress. We don't need to wait for Congress. We certainly want them to step in, but it probably isn't happening soon. But today, tomorrow, state legislatures can introduce bills to regulate these products, and that's where we have an example in Massachusetts. My program, Striped, is working with a community partner, the Multi-Service Eating Disorders Association, led by Beth Mayer, and Representative Kay Kahn in the Massachusetts State House. And Representative Kahn introduced a bill in this legislative session to ban the sale of dietary supplements sold for weight loss or muscle building to minors, so anyone under 18, and to move those products behind the counter so that they are not, any consumer coming through the store is not inundated with a visual field filled with marketing about how they should use these products. We don't want that kind of marketing happening out there. It's misleading consumers, it's exploiting people with weight concerns, and exploiting youth. So the bill, if it were passed into law, would move the products behind the counter and also have the Department of Public Health have warning signs. Cities can do the same thing. Cities actually have the power to act now also. City councils can do that, health departments can do this. One by one, we can start, just like was done with ephedra and actually has been done with tobacco, cities and states can one by one start to get this taken care of protecting consumers and youth. And then eventually we would expect the federal government will follow, as it typically does with public health causes like this.